As cases of the novel coronavirus continue to be diagnosed in our communities, I know that each of us have our own concerns about the health of our patients, ourselves, and our families. I would like to address some questions that are frequently being asked, particularly about employees who may have symptoms themselves. If you, as an employee, have a fever or new respiratory symptoms such as cough and shortness of breath, you must not come to work. Please call Occupational Health Services for further instructions. We know that the Occupational Health Services lines have been extremely busy in recent days, and we encourage you to continue to call and to please have patience as we work to increase the capacity of these phone lines, and we will have someone get back to you to answer your questions. If you are concerned because you have heard that a colleague has been furloughed and asked to stay at home, please do not necessarily be concerned that this individual has the disease and that you have therefore been exposed. Please remember that people may be asked to stay at home from work if they were exposed to a potential case, but they may be well and not pose a risk to you as a staff member. You will be notified by Occupational Health Services and Infection Prevention if there is concern that you have been exposed to a known case of the novel coronavirus, and you will be given instructions at that time. It is very important to remember that we must not order tests for ourselves and our colleagues. We are very fortunate at Johns Hopkins Medicine to have a laboratory that has provided us with in-house capacity of testing for the coronavirus. However, this capacity remains limited, and we must prioritize it to those who are at the highest risk. Those of us with potential exposures outside of the workplace will be contacted by public health authorities and given further instructions about the need for potential self-isolation or quarantine. If you have concerns that you have come in contact with someone who is known to have the disease, and if you have been living with or sharing a room with someone who has been diagnosed with the novel coronavirus, please contact Occupational Health Services, share this information, and get further instructions. We know that this is a trying time and the situation is rapidly evolving. We are staying in touch with public health authorities for the latest guidance, and we will provide you with updated information as the situation evolves. Thank you for everything you do to keep our patients, families, and colleagues safe.